This is your brain stem now. Now in the brain stem, see here. This is your This is your midbrain. This is your pons. This is your medulla oblongata. Okay. Now see here, all students. This is the facial nerve nuclei, motor nuclei. It is making a band here like this. This band of the facial nerve, it is known as internal genu of the facial nerve. Okay, it is known as what? Internal genu of the facial nerve. Clear to everyone? Now here one more nuclei is present here. This is known as superior salivatory nuclei. You have to draw this diagram with me. And this is your inferior salivatory nuclei. Please remember, inferior salivatory nuclei through the glossopharyngeal nerve, which is your ninth cranial nerve, it is innervating your parotid gland. Parotid gland is not innervated by the facial nerve. Through superior salivatory nuclei, it is giving the secretomotor fibers that are your GVE. Okay, these fibers it is going to give to the lacrimal gland, to the palate glands, nasal glands, submandibular glands, and your sublingual gland. Okay, so all the glands through, and this superior salivatory nuclei, which I am highlighting in blue color. Now the nerve fibers from here are also joining the facial nerve here. Okay, and there is one more nuclei here, that is your nucleus tractus solitarius. Okay, so the tip of the nucleus tractus solitarius, here the fibers are also joining the facial nerve. So all these three fibers together, they are known as the facial nerve. Okay, so this one is the motor fibers of the facial nerve, and nerve fibers from the superior salivatory nuclei and the tip of the nucleus tractus solitarius, they are the sensory nerve fibers. So they are known as what? Nervus intermedius. So sensory node nervus intermedius, it is formed by the fibers of superior salivatory nuclei and the tip of tractus solitarius, like this. Now they are making the facial nerve nuclei. Facial nerve. Now the facial nerve is exiting at which junction? Ponto. This is medulla oblongata. This is pons. So this is your pontomedullary junction. Okay. Now as it exiting there. Now see here, all students. Now it is going to enter into the internal aquatic meatus. It is entering where? Into the internal aquatic meatus. So as it enters into the internal aquatic meatus, what is going to happen now? Okay. So as it enters into the internal aquatic meatus, in the internal aquatic meatus, please remember, along with 7th cranial nerve, which nerve is present? 8th cranial nerve is also present there. Okay. So now it is entering here into the internal aquatic meatus, making a band here. This band is known as external genu of the facial nerve. See here, this band here, this band here, this is known as the internal genu of the facial nerve. This band here, it is known as what? External genu of the facial nerve. Now as it and exiting here at the external This is the external genu of the facial nerve. Now see here, as it is entering into the facial canal, now the nerve is present where? Our facial nerve, it is present in the facial canal. And now in the facial canal, the nerve will swells to form the geniculate ganglion. This is your geniculate ganglion. Sensory ganglion, which is going to take the fibers from the anterior two-thirds of the tongue and it will send it to the tip of the nucleus tractus solitarius here. Tip of the nucleus tractus solitarius. So this is the geniculate ganglion. Okay. After the geniculate ganglion, see here. Now the nerve fibers are going like this. And now it is going to give here one branch. One branch. Second branch. Third branch. And now it is exiting the stylomastoid foramen. So this is your what? Stylomastoid foramen. And as it is exiting the stylomastoid foramen, here there will be presence of what? This is your parotid gland. So this is your which gland? Parotid gland. So it is not innervating the parotid gland. Please remember it forever. Parotid gland is not innervated by the facial nerve. Okay. So please remember the facial nerve passes forward through the parotid gland and then it is going to give here 5 branches. Passes through the parotid gland and give here 5 branches. Temporal branch, zygomatic branch, buccal branch, mandibular branch, and cervical branch. Okay. Now see here, if patient is having lesion here after the stylomastoid foramen, all these muscles are becoming non-functional and patient will develop what? Bell's palsy. Patient cannot close the eye, there will be no wrinkles. They're on the same side, not on the opposite side. It is an infranuclear lesion. Okay, on the same side. Now these 3 branches of the facial nerve. This branch here, this is known as greater petrosal nerve. This is your which nerve? Greater petrosal nerve. So see here, greater petrosal nerves arises from the nerve to the geniculate ganglion. So these are your parasympathetic fibers. And now it will go and make here a ganglion. This ganglion is known as what? This ganglion is known as pterygopalatine ganglion. Pterygopalatine ganglion. And now the nerve fibers from here, they are going to innervate the lacrimal gland, the nasal gland and the palate glands also. Okay. So this is your pterygopalatine ganglion. Okay. So the greater petrosal nerve, it is forming your pterygopalatine ganglion. So these preganglionic fibers are the greater petrosal nerve. These postganglionic fibers, it is from your trigeminal nerve. Okay. Trigeminal nerve. Please remember it. It is from your trigeminal nerve. Now one thing you can add here that is very, very important. Here there is a formation of a canal. This canal is known as Pterygopalatine canal. And here one nerve is entering here and joining with the greater petrosal nerve, now forming here this nerve. This is the nerve of the Pterygopalatine canal. This nerve, this one, this is known as what? This is your deep petrosal nerve. Deep petrosal nerve. Now you are going to ask me, sir, where this deep petrosal nerve come? Please remember, here you have your internal carotid artery. And along the internal carotid artery, it is surrounded by your T1 sympathetic fibers. From these T1 sympathetic fibers, these are your what? T1 sympathetic fibers present and around your internal carotid artery, which are coming out from your superior cervical ganglion. Okay, and now it is forming here this nerve. This is known as deep petrosal nerve. Deep petrosal nerve join with the great petrosal nerve, entering into this canal known as the nerve of the Pterygopalatine canal. And now it is forming here this ganglion, Pterygopalatine ganglion. Now it is innervating these three: lacrimal, nasal, and the palate gland. So see here, these three are by your Pterygopalatine ganglion. The two remaining, submandibular and sublingual, these two, it is by your submandibular ganglion. It is by your what? Submandibular ganglion. Now see here. Second branch is the nerve to the stapedius. Nerve to the stapedius. Third branch of the facial nerve, this is known as chorda tympani. Now this is very, very important. Now chorda tympani is going, and now it is making here this ganglion. This is your submandibular ganglion. Okay, so chorda tympani, please remember, it arises from the facial nerve in the facial canal. Okay, and it contains preganglionic. Okay, so this is your what? This is the ganglia, so it will be your what? Preganglionic nerve fibers. Which nerve fibers? Parasympathetic preganglionic nerve fiber. This is also your preganglionic parasympathetic nerve fibers. Okay, so chorda tympani contains what? Preganglionic parasympathetic secretomotor nerve fiber to the submandibular ganglion, and here it is going to form. Again, the trigeminal nerve is going to help here by the lingual nerve, which is a branch of the mandibular nerve. And now it is going to innervate your two glands. Which two glands? Submandibular gland secretion and sublingual gland. Clear? So this is how it is innervating your nerve fibers. So once again, see all students, it's not difficult, it's very easy. Now one more thing, all these fibers, see here, they are the branches of the facial nerve. And here if I draw here the tongue, for example, this is our tongue now. So tongue, please remember, anterior 2/3 of the tongue taste fibers. It is also by the facial nerve. And now it is also taken by the chorda tympani. And from the chorda tympani, it is going into this geniculate ganglion. Because geniculate ganglion is our sensory taste. For taste and sensory sensation, it is received by the geniculate ganglion. And from here, the fibers are going here into the facial canal, internal aguated meatus, and now it will reaches at the tip of the nucleus tractus solitarius. So the tip of the nucleus tractus solitarius It is taking the sensations of the taste, receiving from the anterior two-third of the tongue. Okay, so this diagram is very